Metastatic brain tumors are tumors that have spread to the brain from another location within the body. This typically comes from lung cancer, colon cancer, breast, renal cancer or kidney cancer, other cancers. Most any cancer, but not all, can spread to the brain. And when that cancer has spread into the brain, either within the brain tissue itself or outside of the brain, pushing on the brain, it's called a metastatic brain tumor. Metastatic brain tumors are very common. They're much more common than primary brain cancer, and they're becoming increasingly common as we see people doing better and better with the treatment of their cancer in their body. It allows people to live longer than they ever used to be able to live. And in that living longer, we're seeing that the cancer is having the opportunity to spread to the brain. In keeping up with living longer, as we're doing better and better with cancers in the body and the treatment in the body, it's also important to remember to look for cancers in the brain and treat them as aggressively as we would the cancers that are in the body. The treatment for metastatic brain tumors has made some evolution in recent years. There's been a shift of using surgical resection as the primary treatment for a metastatic brain tumor to now using radiation more often than surgical resection. We often still need to use surgical resection as the treatment option in certain circumstances, but there are other circumstances where we're becoming more and more able to use stereotactic radiation therapy to deliver to the metastatic brain tumor, particularly then if there is more than one location of that metastatic brain tumor. The advantage of this is, of course, the lack of surgery and just the delivering of radiation, avoiding the downtime of surgery and the pain and discomfort of surgical intervention. Cancer Treatment Centers of America has the full options of treatment available for metastatic brain tumors. This includes surgical resection of the brain tumor, either with biopsy or full surgical resection, radiation therapy, chemotherapy, and immunotherapies. Immunotherapies focus more on augmenting or helping the immune system to fight the cancer. This starts with evaluating each patient individually, because the cancers present in a wide variety of ranges and do need a very tailored individual approach to each particular patient. One may have the need to identify the pathology of the metastatic brain tumor. There are occasions where a brain tumor will appear and is obvious that it's a metastatic brain tumor, but a tumor is not found anywhere in the body. In this circumstance, tissue would need to be obtained for pathology. This could be done through either a biopsy or surgical resection and removing the entire brain tumor. In other circumstances, we already know the diagnosis because we know that the patient has, for example, lung cancer, and now we identify a brain tumor that's very consistent with a metastatic brain tumor. We don't necessarily need to obtain additional tissue in that circumstance, and one in the right setting could move towards radiation therapy, either whole brain radiation or stereotactic radiation, and avoid the need for surgical intervention. Of course, in conjunction with all of these treatments, chemotherapies are needed to help both with the control of the tumor within the body, but also within the brain.